Commonly at Port Moody Health, I see tendonitis, which is a gradual breakdown of tissue that happens because we're repetitively using the same muscles or muscle groups. We're not giving ourselves enough rest or enough nutrition to actually build those back up. So in soccer, in combat martial arts, many other things, you get torque and trauma to the knee that actually causes a breakdown of the ligaments, so especially ACLs, MCLs, you see meniscus damage. Eventually that causes a breakdown in the joint as well, so as things start to degrade, you get pain. All of the sports movements that we do actually break down tissue, and that's a good thing. We want to break down tissue so that it can grow back and then grow back stronger. But if we're not giving ourselves the time and the resource to actually build things back up, we're going to see a gradual breakdown. We're going to actually be worse the next day than we were the day before. We're not building, we're not giving ourselves that time to grow. So to treat that, we're going to be looking at nutrition, we're going to be looking at how the person is actually functioning and how they're moving. If they're excessively breaking down their body by improper biomechanics and by using improper movement patterns, they're going to have more problems, and it's going to be hard to treat that just by nutrition or just by painkillers. Depending on where they're at, we might look at acupuncture, we might look at some botanical medicine supplements that kind of bolster their nutrition. Obviously, we're going to focus on diet and be sure they're getting the basics there. From there, we can get into the fancier therapies. We can get into some injection therapies to help to regenerate some of the ligamentous tissues. We can offer some adjustments and joint mobilizations to be sure things are moving appropriately. It changes person to person depending on what they need. That's what we try to offer. If we can't offer it, we'll find somebody who can.